It's Dr. Dawne. I am back again. It's Dr. Dawne, Chicago's on board certified OBGYN. I am working on 2 modalities. I'm on Facebook Live and I'm on Periscope. I'm trying to do 2 things in one, so bear with me. But again, it's Dr. Dawne, Chicago's on board certified OBGYN. My mission is to empower women of all ages with pertinent medical knowledge and proactive sexual education that will optimize their mental and physical health, strengthening their self-esteem, and motivating them to do more for themselves. So I like doing these talks on different topics. I am a hospitalist, OB hospitalist, and I work at a hospital where I see a lot of ladies that don't have doctors, or maybe they're not in the same town as their hospital, so they come and they see us and they're pregnant. So I see a lot of interesting cases. So this topic I'm going to talk about today is way related to what I saw when I was here at work. So the topic I have is vaginal discharge. On the face of it, it looks like that's kind of boring, but it is something that we need to know about, because the question is, okay, what's normal versus what's abnormal? Because you depending on what's going on in your life, you may have both. So what is normal vaginal discharge? Normal vaginal discharge is there. It can be watery versus thick. Usually it's clear to white colored. And it really is dependent on where you are in your menstrual cycle in terms of the consistency of it. So typically, it'll be thinnish if you get closer or thinnish when you're closer to when you're ovulating. It thickens up when you're away from it. So, hey, hubby, Olu, hey, Helena, thanks you guys for joining. So, depending on where you are in your menstrual cycle, it'll be thick, thin, white versus clear. And it may have somewhat of a smell, not necessarily a bad odor, but it's just a smell. That's just how you are. And that's not abnormal. It's not abnormal for it to be increased in amount. You may have a lot more versus not a lot. And that's all normal. And I say that because a lot of my young girls come in and they're really freaked out because they got this vaginal discharge. And I'll do an exam and I'll tell them, hey, this is normal. You're a healthy young girl. You're going to have vaginal discharge. If it gets to be, hey, Dr. Donna, if it gets to be kind of heavy, you may want to do a panty liner. And I usually tell them do the unscented, because sometimes even the scent, hey, Cindy, sometimes the scented panty liners can give you irritation. So if you have a lot of heavy discharge and it's bothering you, I will get to that question. I got a question from Helena about people eating pineapple to change the scent out of their vaginal discharge. So I'm going to get to that. But they come in and they have normal vaginal discharge, and I have to convince them that they're normal. And that's kind of why I do these Facebook posts, because I want ladies to know how much they are normal as opposed to abnormal. Unfortunately, there's a lot of information out there that makes women feel like they're abnormal, like they have to do extraordinary things to be acceptable. And you're already acceptable, you're already normal. You don't have to necessarily do anything to be normal. And unfortunately, there are a lot of businesses out there who make their money on women buying their products, and they get people to buy their products because they make women feel like they're abnormal. So half of the time I'm convincing women that no, you're okay. You don't have to do extraordinary things. The human body is an amazing piece of work, so it typically will take care of itself as long as you're doing what you need to do in conjunction with that. So normal vaginal discharge, drinking a lot of water will help you with that. But so what is abnormal? When we come in, some of my ladies do come in with abnormal discharge. And typically that's because you may have some type of an infection that's going on that I may need to treat. So if you came on, hey Allison, thanks for joining. If you came on Monday, I think I did a talk. We were talking about reasons to come in to see a gynecologist. And one of the things I mentioned was the HPV viral infections, because that can set up a vaginal infection too. Usually, you may not even know you have it. because the body, as it typically will do, will kind of fight it off on its own. But that's one type of infection you'll have. The most common that women come in to see me about are Candida or yeast infection and bacterial vaginitis, which is BV. And they're very common. Typically, these are sexually active women, but it doesn't necessarily mean these are sexually transmitted infections. Those are different infections that I'll talk about briefly. But the yeast infection is prominent when the level of the yeast that's in your vagina gets to a higher level. So the vagina is not 100% minus bacteria and fungus. You have bacteria and fungus, which is yeast, in your vagina, and that's normal. So you don't have to do certain things to get rid of them because that's part of the normal vagina. Andrea Orr, hey, how you doing? Thanks for joining. So you typically will have this bacteria or fungi in the vagina, and it's not a big deal. Typically, your body will keep it at a certain level, depending on what's going on with you. If you're sick, if you are sexually active, and maybe you're introducing different things into the vagina, you're not necessarily using a condom, but this, you may have a change in your vaginal environment, which will allow certain bacteria to grow more so than other. So sometimes that will be the yeast, and it can be a bear for women when they have them. And most of us know those symptoms. You got this really bad itching. You got a thicker discharge. It's usually white. Thank you. It's usually a white, thick, and it really itches. And it itches like nobody's business. So most of my ladies are calling me on the phone like, Dr. Collier, I need you to send me a script because it's back. And that's the thing about the yeast infection. Not typically, but a lot of times I have to treat it more than one time. It comes back. And unfortunately, I have some ladies that almost every month or every couple of months they're getting this yeast infection. So there are different medicines that you can use for the yeast infections. A lot of them are over-the-counter, and they work just as well as what we prescribe. So the over-the-counter medicines, Monistat, things that are in that category, they're usually a cream or a tablet. Hey, Dr. Mia, how you doing? Cream or a tablet that you can put in the vagina, and you'll use it for anywhere from 1 day, 3 day, 7 day. I usually do the 3 day for my ladies. And when you use this medication, you don't want to have intercourse during that time. So 1, 3, or 7 day cream or tablet or ovule or whatever, and that will help you get rid of that infection. So, hey Wanda, how you doing? So there's other medications that we can use, which is an oral pill, and that's a 1 day pill that you can use. So we can take that pill. And typically you just take that one pill and you're good to go. You don't need anything after that. So depending on the woman, hey Dr. Michelle, depending on the woman and what she is comfortable with, she may either have the vaginal medication or the oral pill. And one works better than the other, not necessarily. It's just some ladies enjoy one route versus the other. So now I will have ladies, like I said, that come in and they just keep getting this infection. They're not necessarily having sex with a whole bunch of people. They just have this yeast infection. It can be harder to treat. So for those ladies, I'll usually put them on a suppressive therapy. That means that they're on long-term therapy, and even if they are not having symptoms, they will still be on the therapy. And so you may just take this pill once a month, as opposed to just one time. You may take it once a week in conjunction with the vaginal medications. I really try to tailor it to the lady, and depending on how prevalent her symptoms are and how often she's getting these yeast infections. Now, one thing to remember, that sometimes the yeast infection, especially if it's recurrent, that can be a symptom of diabetes. So diabetes is a systemic disease process, and it affects all different organ systems. And so sometimes my ladies come in and they have been getting this yeast infection, and we have to, hey Melinda, how you doing? We have to do some testing to make sure they're not developing diabetes. And that is a whole nother lecture, but it's something that we need to know, and as soon as we can diagnose diabetes, the better. And oftentimes the yeast infection could be one of the symptoms that we get. So that's the yeast infection. The other culprit that I have tons of ladies that coming into my office about are the bacterial vaginitis, and that could be a bear too. Usually the hallmark of this is an odor, a strong fishy odor, and it's different than what you've ever had. So now you have a normal odor to your vaginal discharge is not something that you need to worry about. But this one is really strong and really, different. So, hey Kim, how are you? So with the bacterial vaginitis, the same type of thing. We usually have vaginal preparation that we can give you. We do it for about 5 days. It's gel, you put it in the vagina, and that will treat it. We also can give a pill form of that. It's called Flagyl, and you take that twice a day for like 7 days. Some ladies don't like the Flagyl because it can give you this weird metallic taste when you take it. So, hey Natalia, thanks for joining. So a lot of my ladies will just do the vaginal prep. With the vaginal prep, you really shouldn't have sexual intercourse. So depending on what's going on in your life, ladies will do the pill versus the vaginal prep. Now, the interesting thing about the bacterial vaginitis is sometimes we'll see this in our ladies who have preterm labor or are pregnant. We don't necessarily always treat it, but if we do see it and we have a lady that is going into labor early, we'll treat it. And I bring that up because that's what I do. I take care of high-risk patients. And a lot of my ladies come in and they're, term, when we say you're full term, that's usually about 40 weeks. And docs, we go in weeks, we don't go in months. So ladies, you guys will say, oh, I'm 9 months, so I'm due any day. But that's really 10 months. I hate to tell you, but you're really pregnant 40 weeks versus really 10 months. But so we'll talk in terms of 40 weeks. Terms is going to be 37 to 40 weeks, and you might go past your due date. So we find that some ladies that have bacterial vaginitis when they're pregnant, depending on what's going on, they may go into labor early. So we like to treat those ladies if we find it. So bacterial vaginitis, yeast infection or candida, that's the official term. Those are two of the main ones we see that are not necessarily sexually transmitted. Hey Tamiko, thanks for joining. So now the other heavy hitters that we typically hear about are chlamydia, gonorrhea. David Fuller, thanks for joining. Chlamydia, gonorrhea, trichomonas. And unfortunately for these, you may not have any symptoms. So the ones that are not sexually transmitted and not really causing disease beyond you having it, you got symptoms all day. Hey Athena, thanks for joining. But the ones that can cause problems later on down the line, you may not know you have it. All right? So that's the bad thing about it. So let's talk about gonorrhea and chlamydia. I'm going to talk about those together because a lot of times they go in pairs. So when we treat or when we're testing for it, we'll test for gonorrhea and chlamydia together and treat you. Chlamydia can be no symptoms, or you have an increase in your discharge. You may or may not have an odor with it. Gonorrhea. Typically with gonorrhea, if you've had it for a while, you'll have more discharge and it'll be a little more painful when you have intercourse. Hey, Dr. Teresa, welcome. Thank you for joining. So if you notice that you're having sexual intercourse, and it's becoming a little more painful or uncomfortable, then you want to come in, especially Dr. Anamar, thank you for joining, especially if you find that the discharge is increased or it's a change in color. And that's the other thing you want to pay attention to. As I talked about it earlier, clear, white discharge, that's pretty normal. If you're finding it's yellowish, greenish, it's more to it, you got more pain there, then you want to come in and see your gynecologist so you can get checked out. Typically, we can give you a shot or give you some pills, and that will take care of it. But you do want to come in for that. The other one that we see that is sexually transmitted is trichomonas. Again, no symptoms. Most ladies are like, I have what? Yes, you have trichomonas. And I hate to tell ladies this, but they do. So, trichomonas, you may not have any symptoms, or you may have increased discharge. But those top three things that we can see. When I talk to you all about the human papilloma virus, I mentioned that you can have high-risk virus or a low-risk virus. The high-risk virus is the one that we're concerned about when we're testing you for cervical, precancerous or cervical cancer. But the low-risk ones can lead to genital warts. And again, I do OB all day. Why is that important? Well, when you're pregnant, you are what we call immunocompromised, which means your body didn't fight off the infections as well as it usually will if you're not pregnant. So when you have genital warts, hey Kari, thanks for joining. When you have genital warts, this is one of the sexually transmitted infections that you can see, but you have to be looking for them. Okay, so let's be real. If you're intimate with the person, depending on the time of the day, depending on where you are, you're not necessarily looking down there to see what's happening. And the wart could be present. It can be really small. It can maybe look like a bump or a larger bump, and you may not even think about it. But typically, they are white raised lesions that look like cauliflower, and they can be all in the perineum, so right around if you're a woman, vaginal area, or up at the top where the hair is. For guys, again, it could be right around the penis. It could be on the penis. So it's very unpleasant when you do notice it. And with that, the warts, we typically have to put some topical medication on it to get rid of it. Sometimes you can burn it off. You can use the medication to put on it, but those are the things that we can do to take care of it. And I brought up when you're pregnant because when you are immunocompromised when you're pregnant, they can really get pretty prevalent. And I never forget, I had probably just came out of training, started working up in Olympia Fields, and this little lady came in and she was pregnant. She was probably like 28 weeks, and she had warts like all down there. Like everything was covered, put it that way. You couldn't make any normal body parts out. So we actually had to go to the OR and kind of laser or burn that off, because when you're delivering, it's very delicate and friable. So if you're trying to deliver during that time, you can have a lot of extra bleeding because the baby's head and everything that you're trying to deliver right where all this is. So long story short, if you see something down there that's not normally there, come in. If you're a lady, come to see your gynecologist. If you're a guy, get in to see your doctor, because it could get a lot worse. Put it that way. So other sexually transmitted infections that we want to talk about are herpes. Herpes is still out there. We don't talk about it, but it's still out there, guys. So herpes typically is a lesion that you can see. Herpes simplex is actually the same virus that you have when you have a cold sore. It's the same virus, but it's genital. So it can look like a small fever blister, a raised bubble and with fluid in it, and they usually have multiple vesicles or lesions that are all kind of socked in together. And again, it's going to be in the same area, but this one is painful. So you get this painful lesion that you're noticing. The bad thing about herpes virus is you can't get rid of the virus, so it could come back. So a lot of times when people get stressed, that you get another lesion. So people who have herpes, sometimes what we'll call as a prodrome. So they'll get certain things that they know that this lesion is about to come. They may have tingling or burning in the area, because it typically comes in the same area every time. Burning in the area, and then maybe 3 or 4 days later, you'll get the lesion. But here's the caveat. You are contagious, meaning you can spread the virus actually before the lesions come. So you're shedding this virus, meaning that if you're having sex, you can shed this to your partner before you actually have the lesion. So you have to be careful, because this person may not even know they're passing it around because they haven't had a lesion, or they may know they have it and just didn't feel like telling you, and people do that. So again, why am I sharing this with you guys? Because you have to be careful. I don't care how old you are. I don't care if you're a teenager, in your 20s, if you're 30s, 40s, 70s, you can still get herpes, chlamydia, and gonorrhea. And I get people all the time, how you doing, Sora? I get ladies of all ages that come in. I won't even tell you. I got a lady who was 60-something, came down with a sexually transmitted infection. How did I get this? well, you probably got it from somebody else. So you can still pick it up. So when I talk on these Facebook Lives about using condoms and protecting yourself, please take me seriously. Please take me seriously. Using a condom can really protect you from a lot of these infections. Genital warts, herpes, maybe, maybe not, because those are actually on the fleshy part of your body, not necessarily in one area, but you just be careful. Know and know your status. That's one of the things that I want ladies to do. One of the reasons that when I talk to you about coming in to see your gynecologist before age 21, one of the things that you do is to get tested for these infections. Get tested for gonorrhea, chlamydia, and trichomonas. And a lot of us, if we're in a relationship and a partnership, we say, oh, well, I've been with my guy for 5 years, or I've been married, so I'm not going to do that. That's fine. That's no problem. Get tested anyway. You need to know your status. I'm not saying anything about anybody's relationship, but things happen. And you don't want to be out there with an infection and you don't know about it. So if you come in and you're getting your pap smear, it'll take me 2 seconds to do cultures with that pap smear. My advice is to go ahead and do it. So we talked about the non-sexually transmitted bacterial vaginitis, yeast. We talked about trichomonas, gonorrhea, chlamydia, and herpes. So the other thing I want you guys to think about is sexually transmitted infections are spread by the fluid. All right, semen, vaginal discharge, all those things can potentially have these infections in them. So we got to think about HIV. We had, I know when I was coming in college, there was a big push about people get tested. That's when Magic came out. So we really it was at the forefront of what we were talking about. We don't talk about it as much now, but we still need to, because it's still out there, it's still prevalent, and you can't look at a person and know whether they are HIV positive or not. And you can still pick it up if you don't use a condom. So HIV is out there. Use your condom, because that is the best way that can protect you. But when we test you, most of our docs, if we're testing you for HIV, we'll also test you for hepatitis B. That's another infection that could be transmitted through the blood. That can be transmitted if you're an IV drug abuser. And again, people don't wear a sign saying, hey, I use drugs, and I use IV drugs, heroin, but that is one of the ways you can pick up hepatitis B and not even know it. So get tested for HIV, hepatitis B. Get tested when you're pregnant. We have even tests for syphilis. I told you guys in another Facebook Live page that we had a young lady that came in. She was 17 years old. I think she wasn't far along in her pregnancy. And she had these red splotches on her, and no one kind of really knew. We weren't thinking syphilis, but we did a battery of tested. Lo and behold, it's syphilis. And when you have these infections when you're pregnant, they pass through to the baby. So the baby then had heart problems and things that were a result of her having syphilis. Hey, Erin, thanks for joining. So, I don't really care how old you are, and I don't care what you do for a living, and I don't care what number, letters are behind your name, or if you have letters behind your name at all. If you are sexually active and you're thinking about being sexually active, I need you to make sure that you are protecting yourself, using condoms, and get your status from your partner too. Ask them questions. If you can't ask them this question, have you had infections? Were you treated? What's your status? If you can't ask those questions, you probably don't need to have sex with them anyway. And if they can't answer those questions, you probably don't need to have sex with them anyway. Because I'd rather you have an uncomfortable conversation and make a decision because of that, as opposed to coming into my office crying because now we have an infection that I don't know how I got it. It happens. And it happens at all ages, however you look, where you live, whatever your zip code. I have worked in most of the zip codes in Chicago, in the Chicagoland area, and it's all the same thing. Don't let them fool you. It happens in Chicago. It happens in Naperville. It happens. It's nothing to be embarrassed about, but you do have to be smart about what you're doing. So I'm going to get off my soapbox, guys. I talk about this stuff all the time because I really want to make sure people know this stuff so they can protect themselves. Hey, Dr. Willisa. So again, it's Dr. Dawne, Chicago's own board certified OBGYN. If you are enjoying these posts, if you're getting anything out of them, share the video. Follow me. I'm on Facebook, I'm on Twitter, I'm on Instagram, LinkedIn, all at Dr. Dawne OBGYN. That's DRDAWNE OBGYN. Ladies and guys, I have a special Facebook group, the Clever Girl Crew. So it's go on Facebook, look up the group Clever Girl Crew, and you can join it because I'm going to start focusing on that group and giving extra information to those people. So get into that group. You can go to my website, Dr. Dawne OBGYN. A lot of the things I'm talking about, I have audiobooks that are available when I talk about contraception and talking about reasons to see your gynecologist before age 21. Those are all audiobooks that I put together. So if you go onto the website, you'll be able to pick those up. And the cool thing is you can kind of listen to me. Isn't that great? You can listen in your car or whatever. So we'll do this again. I'll probably be back on. Today's Wednesday, maybe Friday. But I'll give a sign, let you guys know. But thank you all for joining. I'm really happy that you all are coming and getting some good knowledge. And we'll do this again soon. Bye, guys.